Hello, good evening, everyone. Welcome to the European Fertility Society. We are here today to discuss a very important topic for us, for sure. And as you can see, I'm not on my own today. I'm really happy to have you here. Dr. Claudia Mika is with us. Hello, Dr. Claudia. Lovely to have you. How are you? Hope you are ready to discuss this topic.
I am definitely ready, and thank you for the invitation. Looking forward to the discussion afterwards.
Definitely. We are happy to be able to discuss PCCCP program for you today. And of course, before we start, let me just remind everyone that this is recorded and you will have a chance to ask your questions. My name is Caroline. I will be hosting this event. And as I mentioned, Dr. Claudia Mika is going to start with her presentation, but afterwards there will be time for your questions. So don't hesitate. Please put the questions in the chat so Dr. Mika can answer them for you. And also, before we actually start the presentation, I would like to say that Dr. Claudia Mika is the EFS Certification Committee Chair, and she's also the CEO of TIMOS International Healthcare Accreditation. And here, as you know, we are here to discuss the patient-centered care certification, which is the first certification like this in the world, as far as I know. So this is amazing that we were able to bring this to you, and we are happy to discuss that. And of course, Dr. Claudia Mika has been supporting the European Fertility Society since the very beginning. So we are really proud to have you on board, and we are really excited to be able to introduce this opportunity for clinics as well. So thank you so much indeed. And now I don't want to keep you waiting. We can start with the presentation. And as I mentioned, if you have any question, you can start typing them in the chat right now or afterwards.
So thank you very much for the introduction. A warm welcome also from my side. I am Claudia Mika. I was already introduced to you. I'm currently sitting in Cologne at the headquarters of TIMOS International, and I'm very happy. And it's an honor for me to be the chair of the European Fertility Society Certification Committee and to introduce the patient-centered care certification program today to you. I moved it to a question, and can patient-centered care certification enhance patient experience? And hopefully we get an answer to this together today. Before we go into the program itself, I would like just to clarify what international is understood as patient experience. And here we have the Beryl Institute's definition, which says that patient experience is the sum of all interactions shaped by an organization's culture that influence patients' perceptions across the continuum of care. So it says that it is not only like we ask for patient satisfaction. Are you happy with the reception? Are you happy with the waiting time? Are you happy with this and this? No, experience is really the sum of all interactions, bringing all these points together. And therefore, human experience in healthcare is grounded in the experience of patients, families, members of the healthcare workforce, and the communities they serve. So this is what we understand for patient experience. It's important that we all have the same understanding, because when we talk about patient-centered care, and this is now the next definition I would introduce for today, then we should ensure that we have the same understanding. And here, it's again not my definition, it's an internationally accepted definition about patient-centered care is a person-centered care, patient-centered care, puts people at the heart of health and social services, including care, support, and enablement. It's an approach where users are recognized as individuals, encouraged to play an active role in their care, and where their needs and preferences are understood and respected. And all these points, active role, individualization, patient-centered, services, own care, discussion, these are terms we will have now in the next couple of minutes when we discuss about the certification program. So it's important that we have the same understanding. When I prepared this presentation, we all use artificial intelligence nowadays, and I asked ChatGPT, what do fertility patients fear most? And this was the answer. And of course, it's not unreflected presented here, but I think we all agree from our experience in fertility care that it makes sense what ChatGPT gave us an answer. And I have differentiated between the general patient and when we look for fertility patient for fertility treatment as a health tourist. So this is on the right side, but let's start on the left side. So failure to conceive, emotional stress, uncertainty, anxiety, financial burden, physical strain, physician strain, time running out, social pressure and stigma, impact on relationships, uncertainty of parenthood, and health risks were those topics which ChatGPT gave me, which I, from my experience, can confirm. When we go in medical tourism or health tourism sector, then there are some additional but very similar points. Now it's not the failure to conceive, it's treatment failure abroad, of course, because we travel or the patient traveling. It's quality and safety of care, trust and transparency, health risks, and other points. They're very similar in both groups of patients looking for fertility patients. So we will have an eye on both fears when we go through the content of the certification program. So the question is here, do we need certification? What does it bring us? When we talk about patient experience, when we're talking about patient-centered care, can we offer as a clinic, just offer it? Do we need certification? And I asked the colleagues here, and this beautiful lady said, no, you may not need it. And I agree, you may not need it. But it is a structured framework and a tool for improvement. And I'm a quality person, so I am, of course, convinced of certification programs and accreditation. So it is definitely, it should be understood as a structured framework and a tool for improvement. And if this is what is wished, if this is what you're looking for, in addition, so that you can market it and promote it later on, then the answer may be yes. And definitely it's a commitment. It's a commitment to quality and patient-centered care. So let's go into the details, what it is covered. The areas we have covered by the EFS Patient-Centered Care Certification Program are on the left side. And on the right side, you see again those points which I received from my question to ChatGPT. So the fear of patients. And we try to bring it together. So we have in our program, we have the topics trustful communication, patient-centered care environment, emotional support, personalized care for diverse patients, team qualification and development, leadership responsibilities, decision-making, patient satisfaction experience, and quality management. These are the chapters which we have in our EFS guideline on patient-centered care. So from this guideline, which is free of charge available for anybody, we extracted those chapters where we then transferred this into the certification program. So if you look on the left side, the topics we cover in our guideline, and if you look on the right side, where we have the topics where patients fear the most, according to our research, then you see that they fit quite well together. We need to have trustful communication to build trust, even to explain the financial things behind. We have to have trustful communication to also explain that time may not run out, or what to do we have the personalized care, emotional support, fitting or meeting the demand for emotional stress, uncertainty, and anxiety. So the points fit well together, and therefore, when we go into the details regarding who is involved in the process and what are the process steps, we see here that the certification program starts with the application and the self-assessment, and I give you a few more examples in the next slides what this means. Then there is an online interview, and afterwards there is the provision of evidence, which we may ask. So when we go to the application and self-assessment, you may ask, can I apply? Who can apply? And the answer is, if you are a member of EFS, then you can apply and you can start with your self-assessment. So eligible criteria you find here on the left side is that you need to have an implemented internal or external quality management system, that there should be an index, a list of the quality management system documents available. So a list of policies, procedure, however you call it, SOPs. Then the operation must be in accordance with a recognized code of ethics. It could be as it is published by the World Medical Association, can be other associations, but there should be a code of ethics behind what is done. And this should be confirmed, and you should commit to this. Then the operation should be in accordance with a documented patient care policy or similar. So if you use other wording, it doesn't matter, but something which defines and describes how patient care is understood and lived in the clinic. And last but not least, the operation must be in accordance with all applicable laws and regulations that apply in the country where the clinic is located. So these are the 5 criteria which must be fulfilled for EFS members so that they can apply for the certification program. I mentioned that we do have a self-assessment, and this self-assessment contains 100 questions, yes and no questions. And for the chapters I just presented from the guideline. Examples here is from the different chapters. The first is from the communication. Is the treatment plan including the schedule provided and explained to the patient before starting the treatment? Yes or no? Should be a simple question, and therefore we ask for simple answers, yes or no. Are examinations and medical consultations conducted in a private and confidential setting at your clinic? Yes or no? And if the answer is no, then you should think about what to change in your clinic environment so that you can also change this answer. Again, it's a self-assessment first, from a no to a yes. Another example from the questions is there a standardized procedure to assess patients' emotional readiness before IVF or third-party treatment? And last but not least, as an example, again, number 4 out of 100, are there periodic reviews conducted with the treating physician to oversee the patient's treatment progress? Once you go through the self-assessment, then you see how many yes and no you have. We expect that at least 85% of the questions are answered with a yes. We also added to the questionnaire suggestions, further guidance, how to provide evidence to us in the second step and in the third step of the certification program, so that you can prove that you really fulfill the requirement and that the yes you answered is really a yes. So this is also in the questionnaire. Once all questions are answered and you see that you have at least 85% reached already, or after more preparation, then after some time, then you submit the questionnaire to EFS, and an interview will be scheduled with your clinic And 2 EFS assessors will do the interview for 2 hours, and we would cover all the areas of the questionnaire. The third step then is, after the interview, the assessors will prepare a final report, and they may ask for further evidence. For example, could you provide us the policy you were referring to? Could you make a short video to show us the path from X to Z? Maybe different evidences the assessors ask to ensure that step 1 and 2, and then as the third step, all steps are fulfilled, the questions are sufficiently answered, and EFS can then decide that you are eligible, in this case, to be awarded the certification program award, which is a certificate. In the end, it's a structured catalog of questions that guides the organization. And what we want to achieve is that, although we expect that there is a very high level of patient-centeredness already, that gaps may be identified, that actions can be taken and risks are mitigated, and in the end, errors are reduced. What we also see as a benefit is that staff is engaged and should be engaged, that motivation is increased by working together in a team, in a field of such a certification program, which is not daily routine work, and that the improvement is visible. I'm convinced that this is visible very soon when the clinic starts. And last but not least, that success is also celebrated. Very important, so that steps which are completed and the success is visible, that this is also celebrated. In the end, happy staff, this was the last point on the last slide, means happy patient because it's transferred to the patients directly, and safe, reliable, and transparent care means that the patients are relieved. We talked about fear, anxiety, insecurity. So relieve patients. Efficient and personalized treatment should mean satisfied patients. And emotional support and empowerment should lead to confident patients. And this is part what we want to achieve with this certification program. So in the end, to summarize it, it's a neutral third-party assessment conducted by EFS, which is a reputable organization that confirms the clinic's patient-centered care approach, building trust, reducing fears about quality, ethics, risk, and emotional stress for patients and relatives. And having said this, the question again from the beginning, can patient-centered care certification enhance patient experience? I would support these colleagues here to say yes, and in celebrating this. This is the short summary of our program, and I look forward to your questions, and thank you very much for being with us today. Do a gap analysis and find out where improvement can take place, and this can take place immediately. Whereas when we compare it to a larger clinic, we have already implemented processes, because otherwise a big clinic cannot work. So we have to have processes in place. And when this is the case, then perhaps a big clinic would rather benefit immediately from, because the resources are there to promote and market such a certificate, and then may gain further patients or more reputation or whatever. So at the different steps of the process, the clinics will definitely both win in a different pace and different benefits at the different steps.
Yeah. Okay. Thank you so much. Indeed, it's important to remember that, right? So there are differences, but you can gain actual positive sides of this as well, of course. All right. Thank you for that first question. And time investment. I would like to ask you how much time and energy does this certification really take? Is it weeks, months? If you can explain that to us as well.
Here again, I have to disappoint you that there is no one answer that fits to the question. We have to differentiate again, and I'm sorry that I make it so complicated, but if we, let's consider a small clinic who needs to do that after the working hours to prepare for such a certification. It may take longer. If I have a team of 5 people who can work on it for a few days or weeks, then the result will be visible immediately or after a few weeks. So therefore, it's definitely feasible. It is not too much of a big story when we talk about patient-centered care, focusing clinics, because this is our approach. We are not talking about any clinic. We are talking about those clinics who already have patient-centered care as a focus and want this to be certified or want to find the gaps to go in this direction. And depending on where we start, we have then the faster results, or we need to wait a little bit longer. But in any case, the gap analysis helps. So if you want me to give you weeks and months, I would say 4 weeks plus. 4 weeks is very fast because after the self-assessment is done, we say, oh, we have already more than 85% implemented. And it takes longer, the more gaps we have identified and then to work on it.
Right. And can you give us an example of the clinic that, how long did it take? There was a big difference in between, let's say, two of them.
So we had it within weeks because we started with those clinics who were already well prepared, but it's quite realistic to have it within a few weeks.
Okay.
When you see the questions, then it is feasible. When you, for example, something on your website, information is missing. So this can be easily added. If you have to work on your eligibility criteria, which is to have a policy in place on patient-centered care, and this is not yet existing, then it may take a little bit longer to develop it, to share it, to review it. So these are 2 examples for being faster or taking longer.
Yeah, that makes sense again. Thank you so much for that. All right. So what kind of return do clinics usually see? A reputation, patient volume, partnerships?
All. So all, that's the good news.
Right.
Depending on how you market and promote it. If you're interested in reputation, definitely. I think there's no doubt that if an organization like EFS is awarding a clinic with a certificate, that this has a meaning. So the reputation will definitely benefit from it. If you are already full and you don't have capacities to welcome more patients, so then this is perhaps not a topic you want to work on because you have already a good occupancy rate, and that's fine. If you're looking for it and you promote it in the respective channels, then you will also attract more patients. Networking, EFS has a huge network. So if you want to benefit from it or want to use it for other networks where you knock on the door and said, hey, we have a certification now, would you open your network to us? Then I'm sure this will also happen. So the answer is in the end, could be all 3 or even more. It depends on what the strategy of the clinic also is, what they want to achieve.
Makes sense. Thank you so much indeed. And lastly, additional benefits beyond the certification itself. So do clinic also get visibility boosts like EFS features, PR, marketing supports?
I know the answer is yes. I'm a quality person, I'm not a marketing person, but I know the answer is yes. So what we do is, or what the colleagues at EFS are doing is, there is a directory. So whoever wants to learn about who is certified can visit the website and can see the directory. There are also promotional opportunities. So there will be, on an individual basis, the clinic will be contacted, and then there will be the program for the individual benefits will be put into a package, which then includes that there is visibility via the different EFS associated websites like My IVF Answers or IVF Media, general speaking. We do have different languages, so we will spread the message in the different languages channels. We do have other promotional things. I saw in social media already that the managements were interviewed in a video, so to present also their experience with the certification program, and by this also, of course, presenting themselves as a patient-centered care clinic. So I think these are some of the options, among other options, which are part of this benefit program, which will be then developed on an individual basis, which makes a lot of sense in my perspective.
Brilliant. Thank you so much. And indeed, if you go to the European Fertility Society, you can actually see which clinic already received the certification, how to receive it. Of course, you can also apply and see all the details there. But as you also mentioned, not only EFS, but also My Answers and 5 platforms that we have, all of the certified clinics can be found there easily. So there's definitely a huge, huge opportunities for sure. So thanks a lot. I do see 2 questions in the chat, so thanks for those. The first question that we have here is how often this need to be renewed? How often is it renewed?
Yeah, so we decided that it has to be renewed every second year, if I remember correctly, so that we have the initial certification, and then after 2 years, we will ask for the renewal, which has the same approach, so that we have to ensure that all the questions in the self-assessment will be met, or at least for 85%. We will definitely, from time to time, also review our guideline. So, and once the guideline is reviewed, then this will also be reflected in the certification program. And at that time, we will then adjust the questions as well where needed. But this is the procedure.
Perfect. Yep. Thank you. I hope that helped. I do believe so. And of course, the question here in the next one I see is what about the costs? What are you able to tell us? What about the cost? Yeah, sorry.
I know that the costs depend on the size also of the clinic. So there is not only one fee for the certification program. So it depends on the size and the services. And I think EFS headquarters is after the application is coming in, so that there is an individual quotation, which is then based on the price list of EFS, which is then offered, and depending on, so small clinics, of course, pay less than bigger clinics.
Makes sense.
That's in the
Makes
nature
sense.
of it, as it should be.
Yeah, definitely. That sounds good as well, I think so. Thanks a lot. I don't see more questions, but of course, if you have any, you can type them still right here. But if not, we are also available. So you can just message us directly, and the whole team at EFS will be happy to answer any of your questions. We have a whole team behind the certification, and we are working hard to make it as easy as possible. So of course, you can just get in touch with us, and I'm sure we would be happy to help you out. All right. It seems that we don't see more questions, so we will be finishing for today. But Dr. Mika, thank you so much for today. Thank you. It's always a pleasure, as you know, to have you. And I think that it was well explained. And of course, it's something that we are definitely proud of, and we are working hard to make it happen as well, I guess. So thank you. Anything else you wish to add?
No, I would like to thank you again for the invitation, and I would like to wish all clinics best of luck. I think it is worth a try. We heard from those who already ran through the program that they had a good experience. So they had a good experience with the patient-centered care experience certification program. So I added the E now. Experience is not part of the PCCCP. So I think it's worth a try, and it's very useful. You can't lose anything. You can only win. And therefore, I can only strongly recommend it. Although, of course, I'm a little bit biased because I'm involved in the program. But no, I think it's worth a try. And therefore, I wish all the clinics who are going for it all the best. We may meet because I'm also honored to be one of the assessors for the interviews. So perhaps we meet, and it would be a great pleasure to meet then in this environment again.
Sounds amazing. Thank you so much indeed. Dr. Claudia Mika, EFS Certification Committee Chair, has been our guest. I'm really happy to have you here. And well, we're looking forward to hearing from you. Thank you so much. Have a lovely evening. Take care. Bye.
Bye-bye.